Hey there, I'm glad you're here because today we're diving into a topic that's more important than you might think. Today, I want to talk to you about something you might have heard of, but probably don't think about much: whooping cough. You might remember hearing about it in history class or maybe from your grandparents, but it's not just a thing of the past. Sounds old-timey, right? Like something from the past? Well, guess what? It's still very much around, and it can be pretty dangerous. Even with all our modern medicine, whooping cough continues to affect thousands of people every year, and outbreaks still happen in communities all over the world. So, what is it? Whooping cough, or pertussis, is a super contagious bacterial infection that messes with your breathing. It's caused by a bacteria called Bordetella pertussis, which spreads easily from person to person, especially in close contact. It starts out like a regular cold. Runny nose, sneezing, maybe a mild fever. You might just feel a little under the weather, nothing too serious at first. Nothing to worry about. Yet. But here's the tricky part. In the early stages, it's really hard to tell it apart from a common cold, so people often don't realize they're contagious. But after a week or so, things get intense. The cough kicks in, and not just any cough, the kind that comes in fits, leaving you gasping for air. These coughing spells can be so severe that they make it hard to catch your breath, and sometimes you might even vomit or feel completely exhausted afterward. That's the whoop sound you hear. It's scary to watch, and even scarier to experience. The whoop is actually the sound of someone desperately trying to breathe in after a long coughing fit, and it's especially common in children. Now, here's the thing. Babies and young kids are at the highest risk. For them, whooping cough isn't just unpleasant, it can actually be deadly. Their tiny airways can get blocked, and they can't always cough hard enough to clear them. We're talking about trouble breathing, vomiting after coughing, turning blue or purple, and even seizures. In the worst cases, babies might stop breathing altogether, which is a true emergency. Bonjour. I'm Sophie Dubois, a pediatric nurse from France. Early diagnosis and treatment of whooping cough are so important. If you notice symptoms, especially in babies or young children, please see a doctor right away. Quick action can prevent serious complications and help protect your family and community. Even adults can get it, and they can pass it on without realizing. Sometimes adults just have a lingering cough, but they can still spread the bacteria to babies and others who are more vulnerable. So, what should you look out for? If someone you know has a cough that just won't quit, especially if it comes in intense bursts or makes them whoop when they breathe in, it's time to take it seriously. Don't ignore a cough that lasts more than a week, especially if it's getting worse. Infants might not even cough, they could just stop breathing. That's terrifying, but knowing the signs can save lives. If you notice a baby having pauses in their breathing, turning blue, or struggling to catch their breath, seek medical help immediately. Alright, treatment. Early is best. If you catch whooping cough in the first week or two, antibiotics can help stop the infection and keep it from spreading. Antibiotics work best before the severe coughing starts, so don't wait to see a doctor if you suspect pertussis. But the longer you wait, the more damage the bacteria can do to the airways. For babies, doctors might recommend hospital care to help them breathe and stay hydrated. Hospital teams can provide oxygen, fluids, and close monitoring to make sure little ones stay safe. Don't wait it out. Get help fast. Quick action can make all the difference, especially for infants and young children. Here's something cool. Whooping cough is preventable. The DTaP vaccine for kids and TDAP for teens and adults make a huge difference. Vaccines help your body build protection before you're ever exposed to the bacteria. If you've got a new baby at home or spend time with infants, make sure your vaccinations are up to date. It's not just about you, it's about protecting those who can't protect themselves. Pregnant women should also get vaccinated to pass on protection to their newborns. So, to sum up, whooping cough is real, it's risky, but it's also beatable. Watch for those symptoms. Get treated early, and stay on top of your vaccines. By staying informed and taking action, you can help stop the spread and keep your loved ones safe. Together, we can keep our communities safe. Thanks for tuning in. Don't forget to like and subscribe for more health tips. Stay healthy, and keep breathing easy. Remember, a little knowledge and prevention go a long way in protecting yourself and those you care about.